Medurstand. Understanding medicine.
Professor Aziz Rehman again. We have demonstrated the method of blood pressure measurement with palpatory method, and now I'm going to demonstrate how to determine blood pressure with auscultatory method. So patient is sitting here comfortably, should be seated for 5 minutes with legs hanging on feet resting on the floor, and I apply the cuff like this, about 2 fingers breadth above this fold here, about like this one, and these tubing should be like this. There should be no air in the cuff. I have already deflated, and when I apply the cuff, there should be no air between cuff and the arm. And these two tubings should be on either side of the brachial artery like this. This is the brachial artery. Now this blood pressure apparatus, the column should be at 0, and I would put my stethoscope in the ears and put this diaphragm on the brachial artery. This is the brachial artery. I already checked it, but I'm going to reconfirm it. This is brachial artery. I'll put my stethoscope here. Now at this level, I should not hear any sound. Why? Because blood is flowing comfortably without any obstruction. I will inflate the cuff and take it beyond 120. Why 120? Because I just determined that his systolic blood pressure is 120. So I will inflate it and take it beyond 120. But I'm constantly hearing the sounds. No sounds at all. So I'll take it up to 140, then gradually deflate. No sounds because there is no flow in the brachial artery. I'm gradually deflating. No sounds. Yes, at 120 sounds started appearing. I can still hear the sounds. They are changing their character and intensity. Very clearly audible. They become slightly muffled. I can still hear them. At 170 they completely disappear. So then I've let it deflate fast like this. So these sounds, they appeared at 120, indicating systolic blood pressure, and these sounds were heard throughout the phase of pulse pressure, and at 70 they disappeared again. So 120 is the systolic blood pressure, 70 is the diastolic blood pressure. Previously we used to say that at the level where sound become muffled, that should be taken as a sign of diastolic blood pressure, but these days I think we use the level where sounds disappear completely. Although there is a problem in some cases, there are some rare cases where sounds never disappear. You can hear them even when the cuff comes down to pressure comes down like 10, 20. So in that case, I think you can use the muffling criteria. But for majority, the level where sounds start, you can start hearing sounds, that is systolic blood pressure, and the level where sounds completely disappear, that is the diastolic pressure. Now, how fast you should deflate? I think this is very important. You need to learn how fast. If you deflate it very fast, you are likely to underestimate the blood pressure. And if you do it very, very slowly, you are likely to overestimate the pressure. And typically non-professional, they try to be very careful, and they do it very, very slowly. They typically overestimate the blood pressure. So I think these are some of the variations. You need to learn how fast you have to deflate the cuff. If there is high blood pressure, significantly high, that can be counted, but if it is normal, again it is to be written down. But if it is borderline, if blood pressure is borderline, I think it is best to do it again after 1 minute rest. So this is one thing, and the other thing is, when you are evaluating a patient with hypertension, it is best to do it on both arms and also on the legs. That I will demonstrate when we do cardiovascular examination. So this was the blood pressure measurement. Once you have measured the blood pressure, don't forget to remove the cuff and put it back. Thank you.